When I talk to patients about certain concepts like eating more salmon and less beef and lamb, or drinking certain kinds of things like drinking more green tea, I found out that they really didn't conceptualize what I was saying. When they thought salmon, they didn't think about grilling salmon on a grill. They thought more about doing a salmon cake. Or when I said green tea, they thought that they should buy the bottled teas with all the sugar in it. So I realized that I needed to actually show them what they needed to cook, the tools that they needed to buy, like steamers to steam their vegetables, and all the things that we buy to season that are healthier than using salt. We want to show them how we don't want them to do the artificial sweeteners and some of the dangers of that, so we have a sheet on that. We have examples of a lot of magazines that have recipes, like Vegetarian Times magazine. We have a list of all of the healthy health food stores and different grocery stores and restaurants where they can get a healthier meal than some of the fast food organizations that are restaurants that are in town. And we have a lot of recipes for them. Our goal is as being a healthy food, so that we always try to have greens, because most people cannot visualize greens without ham hocks. So we try to show them how you can steam greens and not lose all the iron and other nutrients in them, and how we can season them with all kinds of other tasty things that can make them just as good, and they don't need to have the turkey or the ham hocks. But we want to show them that there is plenty on this planet to eat besides those particular items that clog their vessels, or else that raise their sugar. And so we're trying to get them away from especially refined carbohydrates and show them examples of the complex carbohydrates that won't promote diabetes in the same rate that the refined carbohydrates, and also won't promote as much obesity. So we're giving them an eating plan that will hopefully prevent or help their diabetes, will keep their arteries from being clogged, and will help them lose weight.
I was diagnosed with coronary artery disease about 2 years ago, and I've also, both my parents were diabetic, and I've also developed diabetes, so I've been trying to eat a healthier diet, and I've fallen way off the wagon. So I decided that I got the flyer in the mail that the class was being offered. I'd had a hard time making it, and I said, this is it, I'm going to go, and aside from the reading I do this, and this is really better. The greens have no meat, and they are delicious. The quinoa is very tasty, so I'm excited, I'm encouraged. I think the fact that they offer this is just phenomenal. To be honest, even though I'd heard about the program, I had no idea that they taught it. I knew that there was a program that somebody did, but I didn't know who did it. So it was really a treat for me when I walked in here today, and hey, they're at the front of the room. So this is really good. It's an example, it's inspirational, and it's just really positive. I think a lot of people should do this.